In this lecture, we turn to utilitarian justice, one of the most influential and controversial approaches to ethical decision-making in healthcare. While other theories of justice focus on rights, procedures, or repair of harm, utilitarian justice asks a single, outcome-focused question: what action produces the greatest good for the greatest number? Utilitarian justice evaluates fairness based on consequences. A decision is considered just if it maximizes overall benefit, often understood as well-being, health outcomes, or lives saved, even when doing so may compromise individual interests. This approach has had a profound influence on public health ethics, disaster medicine, and policymaking. At its core, utilitarian justice is grounded in consequentialism, the ethical view that moral value depends on outcomes rather than intentions or rules. From a utilitarian perspective, resources should be allocated in ways that generate the maximum aggregate benefit. Individual cases matter, but they are weighed as part of a larger calculation rather than treated as absolute claims. In healthcare, this often translates into prioritizing interventions that save the most lives, reduce the most suffering, or generate the greatest population-level benefit. One of the clearest applications of utilitarian justice appears in pandemic triage decisions. During widespread health emergencies, such as pandemics, demand for care may vastly exceed available resources. Utilitarian reasoning supports allocating resources, such as ventilators or ICU beds, to patients most likely to survive and recover. The ethical justification is not that some lives are more valuable than others, but that allocating resources where they will save the most lives produces the greatest overall good. These decisions are ethically distressing precisely because they may require denying care to individuals in order to maximize benefit at the population level. Utilitarian justice is also foundational to public health policy. Public health interventions, such as vaccination programs, quarantine measures, or fluoridation of water, are often justified by their overall benefit to society, even when they impose burdens on some individuals. From a utilitarian standpoint, temporary restrictions on individual liberty may be ethically permissible if they significantly reduce harm or prevent widespread illness. This population-level focus distinguishes public health ethics from bedside clinical ethics, which often prioritize individual patient autonomy. Another key area where utilitarian justice is applied is resource rationing in disaster medicine. In mass casualty events, clinicians may be required to allocate care in ways that prioritize those who can be treated quickly and successfully rather than those with the most severe injuries. This approach aims to maximize the number of survivors, even though it may conflict with deeply held intuitions about treating the sickest first. Utilitarian justice provides a framework for making these tragic choices in a structured and ethically defensible way. Despite its practical usefulness, utilitarian justice raises serious ethical tensions. Most notably, it can conflict with respect for persons and individual rights. When outcomes are the sole measure of justice, individuals may be treated as means to an end rather than as persons with intrinsic dignity. For example, denying treatment to a patient because resources could benefit others more raises concerns about fairness, autonomy, and non-maleficence. Critics argue that utilitarian reasoning risks justifying morally troubling actions if they produce sufficient overall benefit. As a result, utilitarian justice is rarely used in isolation. In healthcare ethics, it is typically constrained by other principles, such as respect for autonomy, procedural fairness, and professional obligations. Ethical frameworks often combine utilitarian reasoning with safeguards that protect individuals from being unfairly sacrificed for the sake of aggregate outcomes. This balancing reflects the recognition that while outcomes matter, they are not the only moral considerations. To conclude, utilitarian justice offers a powerful and pragmatic approach to ethical decision-making in contexts of scarcity and crisis. By focusing on outcomes and overall benefit, it provides guidance for public health policy, disaster response, and population-level interventions. At the same time, its ethical limitations remind us of the importance of protecting individual dignity and rights. Utilitarian justice challenges healthcare professionals to confront the hardest ethical question of all: how much individual sacrifice can be justified in the pursuit of the common good?